Hello and welcome. I am Dr. Ankit Parakh and I work as a consultant in Pediatric Pulmonology, Allergy and Sleep Medicine at Children's Chest Clinic, New Delhi and BLK Max Hospital, Pusa Road, New Delhi. So, do you know that children can have many adverse effects or side effects if they have sleep apnea? In this video, we'll talk about what are the common adverse effects which can happen in children with sleep apnea. Now, we know that almost 10% of children snore at night. And out of these 10% children, 10% of these children will have sleep apnea. So, overall, out of 100 children, it is seen that 1 to 3% of children have sleep apnea throughout the world. That's quite a high number. It has also been seen that parents and doctors are actually unaware about sleep apnea and what complications it can cause. The symptoms of sleep apnea could be mild, but they can be severe. The complications of sleep apnea can develop slowly over time, and sometimes they're not recognized properly. Now, when children snore, the space behind our tongue and the nasopharynx can become obliterated or it is less, and that leads to apneas and hypopneas. Apnea is a condition where the child stops to breathe for a while. Now, this can happen for a few seconds, and then brain would arouse the child. The child gets up and the child starts to breathe again. Hypopneas are period when the breathing doesn't stop but it becomes quite shallow. Now, these apneas and hypopneas could be many hundreds throughout the sleep cycle. And during these apneas and hypopneas, there can be change in the oxygen levels and there can be increase in the carbon dioxide level, which is a waste gas. And there are many arousals throughout the night, and sometimes the parents will not be able to recognize these arousals. And hence, the child might have slept for a long time, but the quality of sleep because of arousals is poor, and this is what is known as a non-restorative sleep. So the complications of sleep apnea could be in the form of behavioral or neuro-cognitive side effects. Children who have sleep apnea, they tend to become hyperactive. They tend to become irritable and they become cranky. Now, these are maneuvers which the child does to make himself active during this day to avoid sleepiness, which happens because of a poor night's sleep. Because of this, a lot of children actually gets erroneously diagnosed as ADHD or attention deficit hyperreactivity disorder. Older children tend to become more sleepy with time. Also, children who get sleep apnea, they tend to have a poor school performance and they tend to have a learning deficit, and gradually their performance would reduce. The other major side effect of sleep apnea is in the form of health issues. Now, children who have sleep apnea, they tend to have a poor weight gain because the sleep apnea doesn't allow the child to sleep well. Older children sometimes can become obese, especially because they are more sleepy and they tend to become inactive and less active during the day. Now, in addition, children who have sleep apnea, they tend to have hormonal disbalance and there is increased production of leptin, which promotes obesity independently. So, sleep apnea and obesity is a vicious cycle. Sleep apnea predisposes to obesity and obesity predisposes to sleep apnea. Now, in addition, whenever children are having these episodes of hypopnea and apnea, there's production of stress hormone, and this stress hormone puts a lot of strain on the heart, which leads to increase in the amount of blood pressure, pulmonary hypertension, and sometimes heart failure. The side effects of sleep apnea can be quite severe. The third important group of side effects because of sleep apnea is the dental problems. Now, children with sleep apnea tend to be mouth breathers, and when that happens, it leads to a lot of formation of plaques, gum problems, and gingival problems. In addition, because they tend to be chronic mouth breathers, the tongue is not well opposed to the palate. And when that happens, the development of the upper jaw is not proper. And that leads to teeth which are malaligned, which are crooked, and might require a lot of intervention from dentist. So, in case your child is having any of these effects because of sleep apnea, you need to get in touch with a child specialist or child sleep specialist for a proper evaluation and management. Thank you.